Hi, my name's Jade and I'm one of the ST7s in Anaesthesia. Welcome to this tutorial on the basics of ultrasound. So today we're going to go through the basic principles of ultrasound along with a little bit of physics. The key principles behind the image you see on the screen, how it's generated, as well as what can affect its quality. We're also going to discuss the Doppler effect. We'll talk about the ultrasound machine itself as well as a little bit of the technique. So first things first, what is ultrasound? So ultrasound in Latin, ultra means above, so ultrasound is above sound, and this is because it's above the range of human hearing. We can hear between 20 Hz to 20 kHz, so any sound waves above 20 kHz are ultrasound. The machines that you've seen in clinical use will work via sound waves in the range of about 1 to 10 MHz. That's pretty big. So how does it work? Well, if you recall what an ultrasound probe looks like, they have special crystals called piezoelectric crystals. They have a really special property that when you apply an electricity current through them, they oscillate and produce a sound. The sound that these crystals produce will then match that of the current frequency that is supplied. The sound from the probe can then be focused by special lenses into a beam, and that goes into the patient's tissues. The shape and the penetration of this beam is determined by the lens or the shape of the ultrasound probe. You'll have seen the common linear probes that produce like a square image on the screen, and also the curvilinear ones that produce sort of a fan-shaped image, and that's the ones that you'll have seen for things like gallbladder, kidney, and also for pregnancy ultrasounds. Now the probes are pretty clever, and they can also receive the same information in reverse. Current goes in, the crystals vibrate, the ultrasound beam is generated. Sound travels into the tissues and it's reflected at different interfaces in the tissues, like the bone, the blood, the fat, the muscle, fibers, and also the nerves. Let's move on to discuss the image that you see, how to optimize it, and what different tissues with different echogenicity look like. Remember that ultrasound is sound, so all the things that you know about how to change sound, for example, volume, frequency, echoing, they all apply. Now let's deal with volume or gain first. You may have heard ultrasound operators say, please turn the gain up. Pay attention to the image so it becomes brighter and noise or the speckle is becoming more noticeable. So gain is equal to volume. Turning the gain up will increase the volume and the brightness of your image. And turning it down decreases the volume and makes it look darker. Now, we're going to move on to the reflection of sound, or rather the echogenicity. Imagine walking into a large, empty, concrete concert hall. When you shout, the sound is reflected by all the surfaces, and that's very hyper-echoic. That's what bone and large nerve bundles and connective tissue, like the pleural surface, will look like. They're strong, solid white outlines. Next, imagine that same concert hall filling up with people, and someone's even thought to pad the walls with foam. What happens when you shout now? Some of that sound will be reflected and some will be absorbed by the lovely foamy surfaces. That is hypoechoic. Think solid organs, gallbladder, liver, kidney, or muscles with their diffuse striated fibers, returning images that are greyish or speckled. Finally, flood that concert hall, full of black, dark seawater. No people, no foam, just water. Any shouts will just not be heard. They're all going to be absorbed. And that is anechoic. Just like the blood in our vessels, arteries or veins, all returning images as neat little black circles or tubes, depending on how your probe is orientated. So we've covered volume, echo, and now we're going to move on to pitch or frequency. Now just a little brief bit on this. Pitch is related to how far your sound will travel. For example, the frequency is related to penetration and image quality. The higher the frequency, for example with the linear array probes, the less penetration but the higher density and the quality of your image. And the converse is true, where the lower the frequency, especially with the curvilinear probes, you get deeper penetration but poorer image quality. Now on to the Doppler effect. The Doppler effect is defined as the change in apparent wavelength of a wave when the observer is moving relative to the wave source, or the converse. Think of it as how the apparent pitch or wavelength of an ambulance's siren will change as it approaches us and moves away, even though the actual sound or the wavelength of the siren has not changed in itself. What does this mean for us when we do ultrasound? The Doppler setting on the ultrasound machine lets us characterize blood flow, where the flow towards or away from the probe is displayed as a pulsing red or blue color superimposed on the ultrasound image. It also helps us differentiate vascular from non-vascular structures. The color does not differentiate arteries and veins, it's important to note. Next, we'll move on to exploring the actual machine itself and some key points on ultrasound technique for when you use an ultrasound machine for procedures. So the ultrasound machine itself is a fantastic practical tool that has vastly improved the success and the safety of vascular access and regional techniques, its main applications in anesthesia. So why? It's portable. Machines are getting smaller and smaller. It's pretty easy to learn and it's moderately priced. It's got zero radiation risk and it provides real-time guidance during invasive procedures. For balance, however, although it is a simple imaging tool, the associated skills of needle handling and probe positioning will require time and experience to develop. You will benefit from one-to-one supervision until your experience builds. Now on to ultrasound technique. We can split this into two parts. The first is transducer handling and the second is needling approach. Let's tackle transducer handling first. Now this may seem like teaching your grandma to suck eggs, but the first step is to consider your hand dominance. Now you want to hold the transducer with your non-dominant hand, leaving your dominant hand available for the actual procedure. For example, I'm right-handed, so I would hold the probe in my left hand for the actual procedure, and for the right hand, I would use that available for the needling or for anything else that I'd like to do with fine movements. I would recommend holding the probe like a pencil. You've got the transducer, now what? Gel. You can never have too much gel. During a pre-scan, non-sterile gel is fine, but always use probe covers and sterile, sealed, single-use gel for the moments where skin will be punctured. Now what? Ergonomics. Think about where you want the ultrasound screen, whether it's behind the patient, in front of you. Think about how you position the patient, the bed or the trolley height. Are you going to sit or stand? And think about where your equipment is going to be. Then find the anatomical structure that you want. When you place the probe onto the patient, think about how you're going to stabilize your scanning hand and or arm in order to maintain steadiness and decrease fatigue. I always rest the ulnar edge of my scanning hand on the patient, ideally on a bony structure for stability, and then, where possible, my scanning arm on a surface like the patient bed or the trolley. Now, once you've placed the probe onto the patient, transducer handling can be optimized by being mindful of the PARTS mnemonic. It stands for pressure, alignment, rotation, tilt, and sliding. The amount of pressure that you apply during the probe can change the underlying structures. For example, too much pressure can obliterate views of underfilled veins, and too little pressure would affect the transducer contact and thus decrease image quality. Something to be aware of: the more stressed you are, the more pressure you may be applying as the procedure progresses. Now, alignment refers to where your probe is in relation to the structure you are trying to find and has relation to needling approach, which we'll talk about soon. Now, rotation is pretty self-explanatory. You might turn the probe to better orientate yourself. Tilt or angulation is one of the more important aspects of probe movement. You want to ensure that your probe is exactly 90 degrees to the structure that you're trying to visualize. Reason being, you'll get the best image when you've found the right tilt. Sliding then refers to when you're trying to trace or follow the path of a vessel or a nerve in order to find the bifurcations or any other anatomical waypoints. You may have heard the terms in plane or out of plane. This refers to how your needle is visualized during the procedure. With in plane, you should be seeing the entire length of your needle as it approaches the structure. This approach is most commonly used for nerve blocks. Needle insertion is in line with the probe and directly underneath the ultrasound beam. With out-of-plane needling, The needle is seen like a small bright dot as you're visualizing it. The needle insertion is 90 degrees to the probe, and you may not always be seeing the entirety of the needle, and you may not be seeing the tip of it either. This approach is more commonly used for vascular access, whether it's peripheral or central. So it takes repeated practice and good hand-eye coordination to find your needle tip. So don't be disheartened if during your first few attempts at scanning, you have no idea what you're looking at. You'll be able to get guidance from the tutors during the course to improve your scanning and needle visualization. So a couple tips that may help are to remember to make small adjustments with either the probe position or your needle, one at a time. Check your alignment by taking a bird's eye, so just a top-down view of your probe in relation to your needle approach. Using hydrodissection where it's appropriate, usually for nerve blocks, and making sure that you've picked the correct type of nerve block needle that is specifically made for improved ultrasound visualization.